My prediction, mark my words, we are not going to see under eye hollowing, at least in celebrities, in the next 5 years. It's going to be gone because we have gotten so advanced with how we do fat transfers, not just from how we process it, but how we can do them in the office, how we can add growth factors to it to make the results so much better. And it can even smooth the skin, make the skin look brighter and tighter. We can add it to other areas of the face, but the under eyes, it looks incredible here.
So, this is a respected plastic surgeon in America who's talking about under eye hollowing and how fat transfer is going to be the next big thing, especially in what they predict to be celebrities over the next 5 years, that they will not be an issue anymore because fat transfer surgical procedures have advanced so much that they're now so much better than they used to be. And actually what you're saying is completely correct. But the only thing I have to say about this is permanent solutions like fat transfer invite permanent problems. Now, there are lots of cases where fat transfers work really well and settle very well and have a long-lasting effect. But the main disadvantage of fat transfer is that it is a surgical procedure. And therefore, if it doesn't go right, which does happen in some cases that we see in our clinic, then you're left with permanent disfiguration, with dimpling, tethering, scarring, and then that would require surgical correction to remove. Now, dermal fillers, on the other hand, are not as long-lasting as fat transfers. They last about a year to a year and a half, possibly even 2 years. But in the unlikely event that they don't settle correctly, because sometimes dermal fillers can absorb water and look a bit puffy, what we call the Tyndall effect. Now, in that instance, you're not faced with a surgical correction. You're faced with a very, very simple dissolving procedure, which involves 1 or 2 tiny injections just to reduce the water retention of the filler, which then can be a very easy, simple correction. So yes, fat transfers might look like an appealing option, and they are, but they come with a big risk, which is the fact that if they don't go right, they may stay like that and they may not be very easy to correct, unlike dermal fillers.